Hello, I am Dr. Sourab Shetty, working as an Associate Prof at the Department of Orthopaedics at Kasturba Hospital, Manipal, trained in joint replacement and robotic surgery. Now, today I will be giving you an idea of robotic surgeries in joint replacements. What is robotic surgery? Now, if you look at the history of robotic surgeries in joint replacements as such, it started with conventional progressing to something called navigation. Now, when navigation surgeries were used, we used to register the joints as such and then plan our cuts according to the alignment of the hip, knee and the ankle and take the cuts conventionally. Coming ahead to robotic surgery, what was added into the robotic surgery was a robotic arm and real-time feedback that we get from the robot as such while we are performing the surgeries. Now, the general misconception is that these surgeries are done by robots only. But these are better called as robotic assisted surgeries than robotic surgeries. We use these robots to increase our accuracy on taking the cuts and decrease the mistakes while placing the implants. So how do we do this? Let me just run you through the workflow of how these robotic surgeries are executed. Now, in the market there are many robots as such. In joint replacements, there are certain robots which require pre-operative CT scans and there are certain robots which map the news by intraoperative mapping. Now, in the robots that require preoperative CT scans, once these CT scans are done, intraoperatively we register the knee by placing sensors so that the robots can corroborate with the preoperatively done CT scans and see the knee or visualize the knee in the same way that the surgeon does. This brings sub-millimeter accuracy while we are planning the cuts for the knee. Secondly, there is real-time feedback that we get while operating. So this helps in deciding the placement of the implants. This helps in balancing the knee better regarding the soft tissues. So we basically have a time machine in our hands. We think that the implants have to be placed in a different way. We just replace or replan the placement of the implants and then finally take the cuts in the best possibly placed way for the particular knee of the individual patient based on his anatomy. Now, when we get such feedbacks, what can we do? We can plan the cuts better. This does decrease the size of the incision that we use, and this also decreases the soft tissue releases that we need to do while putting the implants in. What are the advantages of this? This decreases the post-operative stiffness, increases the mobility, reduces the post-operative pain. Now, post-operatively, how does it help the patient? Post-operatively, since the releases are less, the cuts are planned as minimal as possible as per the individual anatomy of the patient. They have less post-operative pain. The scarring is lesser because of which their mobility is better. Can this surgery be done in all patients? We need to evaluate the patient pre-operatively, look at his deformity, look at his comorbidities and plan these surgeries accordingly. So, meet your doctor regarding the same. Now, what are the pre-operative requirements that we need to have for these patients? These patients, as conventional surgeries, need to undergo the baseline X-rays, the blood tests, and the pre-operative evaluations by all departments. CT scans are required for certain robots. CT scans might not be required for certain robots, but depends on the robot that is used for the surgery. Post-operatively, do you need to be worried about anything else in robotic surgeries? There is no much difference regarding the post-operative protocol as such. The exercises, the medications, and the post-operative restrictions that the doctor has advised has to be followed strictly. Now, leaving all this aside, when we think about studies that are done regarding the surgeries, when you look at partial knees and total hip surgeries, the short-term and long-term outcomes are better. When you look at total knee surgeries, the short-term outcome seem to be better regarding the post-operative mobility and the pain, but the long-term patient-related outcomes and implant survival seem to be almost the same when compared to conventional surgery done by a skilled surgeon. So, skilled surgery combined with advanced technology gives a lot of advantages when you consider robotic surgery in joint replacements, highlighting the fact that these are better called robotic assisted surgeries than robotic surgeries. Thank you.